Welcome to my channel. For your health, don't forget to click to subscribe. Seniors, rebuild muscle and beat sarcopenia in old age with just one nutritious food. Like pain cramps, unsteady walking, these can actually be improved. 25 years of clinical evidence from geriatric medicine experts, muscle reconstruction program from diet to exercise. When an octogenarian falls, the invisible killer behind muscle loss. At 3 o'clock in the morning, an 82-year-old lady Lee was pushed into the emergency room. She broke her femoral neck when she got up at home at night. The examination results showed that her skeletal muscle content was 30 less than that of people of the same age, and she was diagnosed with sarcopenia combined with osteoporosis. The surgeon shook his head and said, "This type of surgery is extremely risky for the elderly. Too little muscle makes post-operative rehabilitation difficult." This is not an isolated case. The prevalence of sarcopenia in people over 60 in Taiwan is as high as 17.7, and it is more than 50 for people over 80. Muscle loss not only leads to mobility problems, but also increases the risk of falls, fractures, pneumonia, and even death. What's more serious is that 90% of the elderly and their families don't know that muscle can be eaten back, and mistakenly regard leg weakness as natural aging. As a geriatrician, I have witnessed countless elderly people losing their ability to take care of themselves due to sarcopenia in clinical practice, but I have also helped many people regain muscle strength after the age of 70 through scientific diet and exercise. Today, I will use real cases and clinical data to reveal the truth that eating the right food, doing the right training, can reverse sarcopenia. 1. Sarcopenia, the neglected health killer of the elderly. A silent process of muscle loss. Healthy adults lose about 0.51 of muscle mass each year from the age of 30 and accelerate to 1.52 after the age of 60. The development of sarcopenia is divided into 3 stages. 1. Muscle loss. From strong to thin, the waist of the pants is loose, but it is thought that old age is naturally thin. 2. Muscle function decline, unable to lift rice bags. Weak legs when going upstairs, misunderstood as bad bones. 3. Disability stage, unsteady walking, frequent falls, and eventually bedridden. 3. Misunderstood signs of aging. 1. Weak legs are normal as you age. Grandpa Wang, a 72-year-old retired teacher, has been having more and more difficulty climbing stairs in the past year. His son urged him to get checked, but he always said, "It's like this when you get old." One day, he stumbled while walking in the park. Examination revealed that his skeletal muscle index SMI was only 6.5 kgm, normal for men 7.0, and he was diagnosed with sarcopenia. Geriatric medicine data show that the risk of falling for patients with sarcopenia is 3 times that of normal people. 2. Leg cramps are caused by calcium deficiency, and calcium supplementation will be fine. Auntie Zhang, 68, often had leg cramps at night. She thought she was calcium deficient and took calcium tablets for half a year to no avail. When he went to the doctor, he was found to have a significant decrease in muscle mass, and a blood test showed low growth hormone levels. This is a common endocrine abnormality in sarcopenia, not just calcium deficiency. 3. Walking slowly is due to age. If you can't walk, walk less. 80-year-old Grandpa Lee walks slower and slower. A journey that used to take 10 minutes now takes 20 minutes. His family that he will be tired, so they simply let him go out less. Unexpectedly, 6 months later, his muscle atrophy worsened and he couldn't even stand up from his chair. Studies show that sitting for a long time will increase the rate of muscle loss by 50. To the key to reversing sarcopenia, seize the golden period of muscle reconstruction. The truth about the reversibility of muscles. Muscle cells have a strong regenerative capacity. Even at the age of 80, as long as they are given sufficient nutritional stimulation, especially high-quality protein and resistance training, they can still activate muscle synthesis metabolism. Clinical studies have shown that after 3 months of scientific intervention, the muscle mass of sarcopenia patients over 65 years old can increase by 8-15. II clinical reversal case, from relying on a walker to walking independently. Case 1, a sarcopenia IA patient misdiagnosed as rheumatism. Patient story: 75-year-old Grandma Chen has often suffered from leg pain in the past 2 years. She was diagnosed with rheumatic arthritis and took a lot of painkillers to no avail. When she came to my clinic, she could only walk a few steps with the help of a walker, and her skeletal muscle index was only 5.8 kgm. Reversal plan: I dietary revolution: eat 150 g of muscle-building food, described later every day, divided into 3 intakes. II exercise intervention: seated leg raise training 3 sets per day, 15 times per set resistance band training. II medical monitoring: supplement vitamin D blood concentration, increased from 18 nml to 32 nml. Results after 3 months: Grandma Chen no longer needs a walker, leg pain disappears, and skeletal muscle index rises to 6.7 kgm. She happily said, "If I had known it was a muscle problem, I wouldn't have suffered for so many years." Case 2, muscle recovery of an 80-year-old. Patient story: Grandpa Yu, an 80-year-old retired cadre, fell several times due to unsteady walking, and his family was going to send him to a nursing home. When he came to our department for examination, it was found that he not only had less muscle mass, but also had significantly reduced muscle strength. Grip strength was only 18 kg, and the normal male is 28 kg. Reconstruction plan: diet: take 20 g of muscle-loving protein per meal, paired with foods rich in antioxidants. Exercise: use light weights 1-2 kg dumbbell for upper limb training, twice a day. Life adjustments: get up and move for 5 minutes every hour. Avoid sitting for long periods of time. Follow up after half a year: Grandpa Yu's grip strength increased to 25 kg, and he could go up and down the stairs independently. His family canceled the plan to send him to a nursing home. He said with emotion, "I thought I could only sit in a wheelchair at the age of 80, but I didn't expect to be able to stand up again." II golden food to reverse sarcopenia IA, clinically proven muscle rebuilding nutrients. Chickpeas, muscle-friendly player among plant proteins. Why are chickpeas the nemesis of sarcopenia IA? A clinical trial published in the American Journal of Geriatrics in 2022 showed that patients with sarcopenia IA who consumed 50 g of chickpeas daily had a 1-2 kg increase in muscle mass after 3 months, which was 70 higher than the non-intake group. Its unique advantages are high-quality protein, 19 g of protein per 100 g, and the amino acid composition is close to animal protein, with high biological value. Unique ingredients: contains L-OPA, precursors which can promote growth hormone secretion and stimulate muscle synthesis. Mineral combination: rich in potassium 475 mg per 100 g and magnesium 49 mg per 100 g, preventing muscle cramps and weakness. Real case: chickpeas stop leg cramps. 68-year-old Aunt Shang had been suffering from leg cramps at night for 2 years. She tried various calcium tablets, but to no avail. I recommended that she eat a small bowl of chickpeas salad, 50 g cooked chickpeas, tomatoes, olive oil every day. After 1 month, the number of cramps decreased from 5 times a week to 1 time, and completely disappeared after 3 months. Examination revealed that her muscle mass increased by 0.8 kg and her blood magnesium level increased from 1.8 mg/dl to 2.3 mg/dl normal 1.723. Guide to consumption. Cooking tips: soak for 8 hours in advance and eat after cooking to avoid indigestion. Proper intake: 30-50 g, about 1-3 bowl per day. Excessive intake may cause bloating. Pairing suggestions: take with foods rich in vitamin C, such as tomatoes and lemons to promote iron absorption. II analysis of the muscle rebuilding mechanism of chickpeas. 1. Promote muscle protein synthesis. Chickpeas are rich in leucine, an essential amino acid. 1 AT per 100 g. Leucine is the switch that activates muscle protein synthesis and can activate the mTOR signaling pathway to promote muscle cell growth. To improve insulin sensitivity, chickpeas are rich in soluble fiber 10 per 100 g, which can delay carbohydrate absorption and stabilize blood sugar, thereby improving the effect of insulin on muscles and enhancing protein synthesis efficiency. 3. Antifoam-beta and antioxidant protection. Contains polyphenols such as CHL-orogenic acid, which can reduce oxidative stress and inflammatory responses in muscles and protect muscle cells from aging-related damage. IV 5 core strategies for muscle reconstruction, full cycle management from diet to exercise. 1. Golden protein intake for the elderly. Ordinary elderly people. 1. 0-12 g protein kg body weight day e. G 60-70 to g per day for 60 kg. Sarcopenia A patients, 1 to 15 g protein kg body weight day, of which 50 are high biological value proteins: eggs, milk, fish, chickpeas. Clinical case, consequences of insufficient protein intake. 70-year-old retired accountant Grandma Lynn believes in vegetarian health and only consumes 30 g of protein per day. Physical examination found that her muscle mass was obviously insufficient and her grip strength was only 15 kg. I made a high-protein diet plan for her: 1 egg, 20 g chickpeas for breakfast, 50 g fish, 20 g chickpeas for lunch, 50 g lean meat, 20 g chickpeas for dinner. After 3 months, her muscle mass increased by 1.5 kg and her grip strength increased to 20 kg. To dispersed intake is more effective than concentrated intake. Studies have shown that dividing daily protein evenly into 3 for meals can increase muscle synthesis efficiency by 30 compared to concentrating it in dinner. It is recommended to consume 20-30 g of protein per meal, such as 1 egg, 20 g chickpeas, 20 g protein. 78-year-old Grandpa Zhao walks unsteadily due to sarcopenia and often needs the support of his family. I instructed him to do seated leg raise training with a 1 kg sandbag tied to his legs and hand grip training 3 times a week, 20 minutes each time. After 2 months, he was able to walk independently indoors, and his 6-minute walking distance increased from 200 meters to 350 meters. Vitamin D receptors are widely distributed in muscle cells, and deficiency will lead to decreased muscle strength and coordination. Studies have shown that the risk of sarcopenia increases to 5 times in elderly people with vitamin D deficiency, 20 ml. Clinical example: vitamin D improves difficulty standing up. 82-year-old Grandma Kian needs someone to help her stand up from a chair, and a checkup found that her vitamin D level was only 12 ml. With daily supplementation of 1000 IU vitamin D3, the level increased to 30 ml after 3 months, and she was able to stand up from an armchair unaided, with significant improvement in muscle strength. For antioxidants, a protective shield against muscle aging. 1 antioxidant diet list. Dark vegetables: spinach, kale rich in lutein and vitamin C. Berry fruits: blueberries, strawberries containing anthocyanins, scavenging muscle-free radicals. Nut seeds: walnuts, pumpkin seeds contains vitamin E and selenium. To clinical application, antioxidant diet reduces muscle soreness. Grandpa Lee, 75, has muscle soreness that lasts 4 to 3 days after each exercise, which affects his persistence in training. I suggested that he eat 100 g blueberries, 50 g spinach every day, and supplement with 100 mg vitamin C. After 2 weeks, his muscle soreness after exercise was significantly reduced and he was able to continue training 3 times a week. 5. Sleep management: the golden time for muscle repair. 1. Effects of sleep on muscles. The deep sleep phase N3 phase is the peak of growth hormone secretion, which promotes muscle repair. Lack of sleep 6 hours day inhibits protein synthesis and accelerates muscle breakdown. Strategies to improve sleep for the elderly. Fixed bedtime. Go to bed before 2300 every day to avoid falling asleep during the day and night. Bedtime ritual. Soak feet in hot water for 15 minutes. Read a relaxing book, and stay away from electronic devices. Environmental optimization. Keep the bedroom quiet, dark, and at a suitable temperature. 2024. Pitfalls on the road to improving sarcopenia. These misunderstandings. Old people cannot do strength training and are prone to injury. Ms. Wang, a 65-year-old retired teacher, heard that it is dangerous for the elderly to lift dumbbells, and refused resistance training and only took walks. 1 year later, her muscle mass continued to decline, and she even stumbled while walking due to leg weakness. In fact, light resistance training, such as 1 kg weight under scientific guidance, is not only safe, but also can enhance muscle strength and reduce the risk of falling. Vegetarians will definitely suffer from sarcopenia and must eat meat. 70-year-old Grandpa Zhang has been a vegetarian for 30 years. Through a reasonable diet plan, chickpeas, tofu, whole grains, his muscle mass and strength have reached the normal level of people of the same age. Vegetarians can completely prevent sarcopenia as long as they ensure protein intake 1 to 15 kg a day and optimize the amino acid combination, such as grains, beans. I just take protein powder, don't bother eating. 80-year-old Grandma Li's son bought her expensive protein powder to supplement her nutrition, but she still had muscle atrophy. The problem is, protein powder cannot replace other nutrients in whole foods such as fiber and minerals, and the digestion and absorption capacity of the elderly is reduced, and the protein in natural foods is easier to use. Weak legs means osteoporosis, just take calcium supplements. 72-year-old Grandma Chen has had weak legs for 3 years. She has been taking calcium tablets and osteoporosis drugs, but the symptoms have not improved. When she went to the doctor, she was found to have severe sarcopenia, with a skeletal muscle index of only 5 kgm. Osteoporosis and sarcopenia often exist at the same time. Calcium supplementation alone cannot solve muscle problems. Muscle reconstruction must be carried out at the same time. Famous Doctors Clinic, 10 common questions about improving sarcopenia continued. I was diagnosed with sarcopenia at the age of 75. Can it be reversed? Doctor's answer, absolutely. Clinical studies show that after 3-6 months of scientific intervention, the muscle mass of elderly people over 80 years old can still increase by 5-10. I once treated an 82-year-old sarcopenia patient. Through chickpea diet resistance training, muscle mass increased by 1.3 kg after 6 months, and he went from needing a walker to being able to walk independently indoors. If I eat too much chickpeas, I will get bloated. What should I do? Doctor's answer, chickpeas contain oligosaccharides, which are easy to cause bloating for first-time eaters. You can gradually increase the intake starting from 10 and increasing it every week, and add ginger to promote digestion. Soaking for 8 hours before cooking and changing the water can reduce the oligosaccharide content. If you still feel uncomfortable, you can switch to chickpea puree, easier to digest, or choose other high-protein beans such as lentils. Can I eat chickpeas if I have diabetes? Doctor's answer. Chickpeas are a low glycemic index (GI) 28 food, rich in fiber and protein, and are very suitable for diabetic patients. Studies have shown that consuming 50 g of chickpeas per day can reduce postprandial blood sugar response by 20. It is recommended to replace part of the staple food such as rice with chickpeas and include it in the daily carbohydrate intake. How long is the appropriate resistance training session? Doctor's answer, for beginners, 15-20 minutes each time is enough, and the focus is on the movement specifications rather than the duration. It can be divided into 3 stages: warm up for 5 minutes, gentle stretching, Training for 10-15 minutes to 3 movements, 10-15 times per set. And cool down for 5 minutes, deep breathing and relaxation. As physical strength improves, it can be gradually increased to 30 minutes time. How can vegetarians ensure protein quality? Doctors answer, vegetarians need to adopt a protein supplementation strategy. For example, chickpeas whole wheat bread amino acid complements each other, close to the quality of animal protein. Tofu brown rice protein biological value increased by 30. Consume 1-2 servings of nuts such as walnuts and almonds every day to supplement essential fatty acids and protein. Besides calcium supplementation, what else do you need to supplement for leg cramps? Doctors answer, leg cramps are common in patients with sarcopenia. In addition to confirming calcium and vitamin D levels, potassium and magnesium supplementation are also required. Chickpeas are rich in both minerals, 475 mg potassium and 49 mg magnesium per 100 g. Daily intake of 50 g can effectively improve cramps. In addition, avoid strenuous exercise before going to bed, and hot compresses on the calves can also help. Can I still do resistance training if I have arthritis? Doctors answer, arthritis patients need to choose joint-friendly resistance training, such as seated training avoids standing and carrying weight. Hydrotherapy resistance training in water reduce joint pressure. Elastic band training resistance can be adjusted, and the range of motion can be controlled. It is recommended to be carried out under the guidance of a physical therapist to avoid aggravating joint inflammation. Will sarcopenia affect memory? Doctors answer, recent studies have shown that sarcopenia is associated with decreased cognitive function. Actin secreted by muscles has a neuroprotective effect, and muscle loss may affect blood circulation and nutrient supply in the brain. Clinical observations have found that after improving muscle conditions, the memory and reaction speed of some elderly people will also improve. How many steps a day are good for muscles? Doctors answer, walking is helpful in preventing sarcopenia, but it needs to be combined with resistance training. Recommendations. Daily activities, 6,008 steps per day including housework, shopping, etc. Specialized exercise, 3 times a week. 15-20 minutes of resistance training each time such as seated leg raises, dumbbells. Avoid sitting for long periods of time, stand up and move for 2 to 3 minutes every 30 minutes of sitting. Do you need to continue diet and exercise after sarcopenia improves? Doctors answer, yes. Muscles have the characteristic of use it, and muscle mass will be lost again after stopping intervention. It is recommended to integrate muscle-protecting diet and exercise into daily life as a long-term habit. For example, resistance training at least 3 times a week and protein intake every day to maintain muscle mass and function. The Home Muscle Reconstruction Plan for Geriatricians. 3-step method for self-assessment of muscle condition at home. 1 grip strength test. Tools home gripper adjustable resistance method. Test both hands 3 times respectively and take the maximum value. Reference value. Men 28 kg, women 18 kg. Values lower than this indicate decreased muscle strength. 2 chairs and test. Method. Cross your arms over your chest. Stand up from an ordinary chair about 45 cm high and sit down again. And count the number of times you can complete it within 30 seconds. Reference value. 14 times for men over 65 years old, 12 times for women. Less than this number indicates insufficient lower limb muscle strength. Minute walk test. Method. Walk briskly on a flat ground for 6 minutes and measure the walking distance. Reference value. 400 meters is normal, 300 meters indicates an increased risk of sarcopenia. 1 week recipe example for chickpea diet. Monday. Breakfast. Chickpea puree on bread 30 g chickpeas to slices of whole wheat bread 150 ml sugar-free yogurt. Lunch. Chickpea vegetable soup 20 g chickpeas, broccoli tomatoes 50g brown rice. Dinner, pan-fried chickpea pancakes 20g chickpeas, 1 egg stir-fried spinach. Thursday. Breakfast, chickpea oatmeal porridge 20g chickpeas, 30g oats 1 boiled egg. Lunch, chickpea salad 30g chickpeas, cucumber olive oil grilled, salmon 50g. Dinner, chickpea and tofu soup 20g chickpea, 100g soft tofu garlic kale. Home resistance training, for the elderly. 1 sitting leg raise. Key points, sit on a chair, support the chair with both hands. Slowly raise one leg until the knee and hip joint are at the same height, hold for 5 seconds, then put it down, alternating legs. Intensity, start with no weight, gradually increase to tying 1 to 2 kg sandbags on the legs. 3 sets 15 times each time. 2 wall push-up. Key points, stand facing the wall. Support the wall with both hands shoulder width apart. Slowly lean forward until the chest is close to the wall. And then push back to the original position. Intensity, adjust the distance according to physical strength. The farther from the wall, the greater the difficulty. 3 sets 10 times each time. Atrial reversal story, from bed preparation to walking in the park. Case, the elderly who were trapped at home by sarcopenia regained their freedom. Patient story, 78-year-old Grandma Zhu, who was originally strong, has suffered severe muscle loss in the past 2 years. She has gone from walking in the park every day to only taking a few steps in the living room, and even needs family help to dress. When she came to my clinic, her skeletal muscle index was only 5.9 kgm and her 6-minute walking distance was only 150 meters. Reconstruction process. Dietary core, 50g chickpeas per day, divided into 3 intakes: breakfast chickpea puree, lunch chickpea soup, dinner chickpea cakes. Exercise plan, seated leg raise 3 sets 15 times per day, elastic band training upper and lower limbs. Nutritional support. Supplement vitamin D 800 IU day and protein powder 20g per day. Results after 4 months, Grandma Zhu's skeletal muscle index rose to 6.8 kgm and her 6-minute walking distance reached 350 meters. She can go for a walk in the nearby park alone. Bert Otter said with emotion, "I thought my mother would be bedridden from now on, but I didn't expect she could walk out of the house again." Case, the muscle rehabilitation miracle of an 82-year-old retired professor. Patient story, 82-year-old Professor Liu suffered a femoral neck fracture due to sarcopenia and a minor fall. After the operation, the doctor predicted that he would have difficulty standing up again. When his family brought him to our department, he was lying in a wheelchair with obvious muscle atrophy in both legs. Reversal plan. Diet, grind chickpeas into powder and add to porridge, soup and batter, 50g per day. Exercise, start with passive joint movements and gradually transition to active resistance training under the guidance of a physical therapist. Psychological support, family members accompany training and encourage in time. Follow-up after 6 months, Professor Yu can not only stand on his own, but also walk 50 meters with the help of a walker. His attending physician exclaimed, "This is the oldest and best recovered sarcopenia patient I have ever seen." Ex-doctor's final advice, 3-level prevention of muscle health. First-level prevention, prevention before aging. Dietary principles, pay attention to protein intake. 0 kg day in middle age, eat chickpeas or other high-protein beans 3-4 times a week. Exercise habits, start resistance training such as lifting dumbbells, elastic bands after the age of 40, to 3 times a week to prevent muscle loss. Weight management, maintain a suitable weight BMI 20-25. Avoid being too thin, lack of muscle mass, or too fat, decreased muscle function. Secondary prevention, early intervention. Regular testing, evaluate muscle mass, body composition analysis and strength, grip strength. Chair stand test every year for those over 60 years old. Dietary adjustment, once muscle mass is found to be declining, increase protein intake to 1-2 kg day and add muscle-friendly foods, such as chickpeas. Exercise prescription, Start systematic resistance training and attend muscle training classes at community senior activity centers. II Level 3 Prevention Improvement of Function. Medical intervention for patients diagnosed with sarcopenia. A personalized planned diet, exercise, nutritional supplements is developed under the guidance of a doctor. Rehabilitation training. Patients with severe sarcopenia, i.e. need the intervention of a physical therapist for professional muscle function rehabilitation. Prevention of complications. Strengthen nutrition and exercise to prevent sarcopenia-related complications such as falls and fractures. As a geriatrician, I have seen too many elderly people who have lost their ability to take care of themselves due to sarcopenia and spend their later years in wheelchairs and beds. 82-year-old Grandma had repeated falls due to muscle loss and finally had to rely on her children for care. 75-year-old Grandpa Wang mistook leg weakness for natural aging and missed the best intervention period. But I have also witnessed countless hopes. Grandma Chen, who insisted on eating chickpeas, stood up again. Grandpa Yu, who did resistance training seriously, could go up and down the stairs by himself. These real cases prove that muscle aging is not inevitable, and muscles can be rebuilt even at an advanced stage. From today, why not make 3 changes? Add a spoonful of chickpea puree to breakfast, eat a chickpea salad for lunch, and have a bowl of chickpea soup for dinner. Spend 10 minutes every day doing seated leg raises, and massage your calf muscles before going to bed. These small actions are all injecting new strength into the muscles. Finally, I would like to give you a famous clinical saying. Aging is not an excuse for muscle loss, but laziness is. Paying attention to every bite of food and taking every exercise seriously can keep your muscles strong in your old age, supporting you to walk freely and enjoy life. If you have any questions about muscle reconstruction, please leave a message for consultation. Let's defeat sarcopenia together and make your later years a better life.